Phyllis. Welcome everybody to the Steeplechase Cancer Center. We're glad you could come out tonight. I'm Dr. Kathleen Toomey. I am indeed Medical Director of the Steeplechase Cancer Center. Also, I am a medical oncologist in private practice on the second floor of the Steeplechase Cancer Center. I'm pleased to welcome you to tonight's program on lung cancer. Lung cancer is a cancer that's been very important to me for a long time. And some of my friends in the back know that it's an area of intense need, and I'm sure Dr. Morosini is going to tell us all about that. We know that more people, and that's men and women in the U.S., die of lung cancer than any other kind of cancer. And that's why we established the Lung Cancer Institute here at the Steeplechase Cancer Center at Somerset Medical Center. And someone asked me about screening, and I'm happy to announce that we know that early detection is key to successfully dealing with all cancers, and very soon the Lung Cancer Institute at the Steeplechase Cancer Center will be launching a lung cancer screening clinic. This is Lung Cancer Awareness Month, and that's why we're all here. The new clinic will offer CAT scans of the chest using low-dose radiation. People who are at high risk for lung cancer can talk to their doctors about the screening, and with a prescription, they can visit the lung cancer screening clinic annually for testing. And we will be following the medical literature of who is a screening candidate, and you'll be seeing a lot more coming out in the news and in your local papers and the radio spots, and of course on the website of the Steeplechase Cancer Center. There have been, and Dr. Morosini will tell us about those recent breakthroughs in screening and early detection, as well as lots of breakthroughs in treatment. And that places us really at a tipping point for this disease and to help us save many more lives. So, without further ado, I'm very pleased tonight to introduce Dr. Deborah Morosini. She's a doctor, she's a physician, pathologist, and a research scientist, and she'll share her journey into lung cancer activism. It's the disease that killed her sister Dana, a non-smoker, at age 44. I know you will be as captivated by her story, enthusiasm, and dedication to advocacy efforts as I am, and please join me in welcoming Dr. Deborah Morosini.
Thank you. Hello, everybody. How is the sound for me here? Is it good for everyone in the way back? Too loud? Are you good? Not loud enough. Louder. Okay, I'll lean in. All right. And if I start to get too soft, I want to hear a lot of clamor from the back. Thank you so much for coming out, and thank you for the beautiful introduction. And I've been so pleased to be here during the day today and to see what a wonderful, compassionate center you have here, because it stands unique in its leadership in that way. And I will be talking about screening, and I'm so excited to be at a hospital where there is screening. I carry around a lot of good spirits, and sometimes they don't let the video work. So that's what's happening tonight. And we're waiting for them to let it work, and I know they will. And then what you'll be able to see is a family movie of my family, and that will give you some inspiration of how I came to be where I am today. And how I came to be here in New Jersey is a story that starts in New Jersey. When my parents met, my mom was a Boston girl, a Boston Irish girl, and she came down to work from the summer at the Monmouth Hotel. And there's a lot of pictures of my mom dancing with her legs thrown high. And we thought, oh, Mommy was like a big Broadway star or something. But no, she was at the Monmouth Hotel. And my dad was a salad chef at a nearby hotel. So my story starts in New Jersey. It continues in New Jersey when my parents went, as my dad was a medical resident, on a bumpy Volkswagen trip when my mom was pregnant. And I was born very soon after that, and I have the middle name of Trenton. I kid you not. So it continues from there. After this, we moved to Teaneck, New Jersey, while my father was a resident in cardiology at the Roosevelt Hospital. And my sister Dana, who later became Dana Reeve, and as I say, my sister married Superman, was born in Teaneck, New Jersey, and her husband-to-be is a Princeton boy, and born in Princeton, didn't go to Princeton, went to Cornell. So they came from New Jersey. Oh, I'm hearing sounds. It's sounding good. At any rate, our story circles back to New Jersey many years later in 1995, a Memorial Day weekend, something that I'm sure all of you can remember. Really, everyone in this room will no doubt remember hearing the news that Christopher had fallen off a horse and broken his neck. And it was something I think people do, it was a really cultural event that people remember where they were and how the news came out. It was very dramatic. And it was really a lot of the celebrity culture we have now, where celebrities tend to be younger and more susceptible to a lot more social evil. So when Chris was hurt, it really had a huge impact on people. And it was again here to New Jersey that Christopher came to the Kessler Rehab Hospital and received amazing care. And our family spent a lot of time with Chris here in New Jersey. And it was this week of Thanksgiving, those years ago in 1995, that he came home for the first time and spent the day with us for Thanksgiving before returning home. And I mentioned this earlier when I spoke, that it had such a poignancy because, you know, here he was coming back to his home, and any of you who've been through, you know, well, all of us have been, yes, through these kind of life-changing events, and it's like a surreal quality when you go back to where you had been before. And there was such an element of, there was such a potential element of great sadness and loss, and yet what remained for our family at that moment were those moments interspersed with this feeling of incredible joy that he had survived and that he was alive. And that was this Thanksgiving week, you know, those years ago. I have trouble counting now that we're in the 2000s, but it's, I guess, about 16 years ago. So that's a you know, momentous week for me. And this month of November is also the month when Chris left the world, and that was only 6 years ago now when he died of this, of the complications of spinal cord injury. And New Jersey does circle back again. I'll give you one more last Jersey story before I go into my own story that's not in New Jersey. And that is that my sister, and many of you may have seen her, she performed a lot at the New Jersey Shakespeare Festival, where her great friend Bonnie Monty was the director. And my family was, you know, I have a son that's an actor. I won't hit the lav again, sorry. And we all went to probably every single play my sister was ever in, no matter where. And I had really enjoyed that beautiful theater. So taking us back to Dana and Chris's enormous kind of bravery in the face of what happened to them. They were young. You know, Dana was in her early 30s when Christopher was injured. You know, Chris was 42 when he had his spinal cord injury. And only 52 when he died. So they were young. You know, this is something that's hard to remember. These were young people. He had, you know, at the time he felt really grown up to us because we were 10 years younger. But he was 44 and really made a very radical choice in what he did with his injury. You know, he had the means to really just withdraw into his own life, and what he did was so immediately turn his own misfortune into this intense political activism and extreme amount of giving back to the community and applying his not small but rather enormous intelligence to this problem of paralysis and spinal cord injury. And my sister joined him in that battle. And I think what I do hope that their spirits release this video because it's really good. And what it will show you is how very, very ordinary they were in the midst of all this. That they were able to do these extraordinary things And yet they really, really did not lose sight of the fact that this bravery and this honor and all that they kind of embodied publicly is in all of us. And they didn't let that just sit with them. And my sister just repeatedly would say, I'm not a saint. I'm a regular person who's staying with her husband. You know, and people wanted her to be kind of deified for doing what she did, and she felt like, no, the ones who are the saints are the moms caring for their young 18-year-olds who've had a diving accident, who don't have all our money, who don't have all our visibility, and don't have this enormous amount of community support. So they felt very, very privileged to be in a position where they could influence the way paralysis was seen and make enormous changes. And really, when Chris was injured, you didn't hear about stem cells. And now they're really, you know, this is a part of medicine as we know it, in many areas, in cancer as well as in neurology. So he made enormous strides in the world in the years that he had alive after he really essentially had a life-ending injury. And it was 9 months after Chris died, very suddenly, that my sister began to reinvigorate her own career. She had had if any of you ever saw this, I really hope you did. She had had a lunchtime television show with Deborah Roberts. Anyone who ever saw it, raise your hand. It was the funniest show on earth. It was called Lifetime Live, and her first guest was Hillary Clinton. So she had really good guests, and it was noon on Lifetime television. But other than that, she had done a lot of local theater. She had done some Broadway and a little bit of acting here and there. But really, as the years went by, she started to turn back towards saying, I want to keep acting. And after Chris died, she sang cabaret. She went to Feinstein's Cabaret in New York and did a beautiful, beautiful cabaret show. And that was in June of the year that Chris died, of 2005. And it was during that time where she started to notice she had a very mild cough and shoulder pain. And I had been the person that diagnosed Dana's pregnancy, actually, because she had been staying with me at the time and kept saying, when I wake up to go to the bathroom at night, I feel, and I said, no, nobody else wakes up to go to the bathroom at night, you're pregnant. But this time, no, I mean, she had a cough. She had nothing anyone worried about. And when she spoke to her physician, you know, he had her come in, and we thought, oh, she might have choked on turkey at Thanksgiving, and this was the story. And she probably had aspirated and had turkey stuck. And it was really continued to be, as the story evolved, and it was in early July of that year, that she was diagnosed with stage 4 lung cancer, with a very large tumor in one lung and in her liver and in her bone. And it had been the tumor pressing actually on her, you know, on her shoulder that had caused her this great pain. And this was 9 months after Chris had died. So it was really, you know, it took a lot for my family and I to even, and for Dana herself, to even take this in any way. And while she did everything she could and she had great treatment, she did die within 7 months and died just before her 45th birthday in March of 2006. And it was after that point where people began to, the Lung Cancer Alliance actually approached me, which is a group on whose board I sit today, and said, can you come help us? We need people, you know, to tell their story. And you know, I'm a third-generation physician. I had just lost my sister to lung cancer. I'm, you know, relatively aware. I read the New York Times every day. And I thought at the time, well, why would you want me to do this? Aren't there people that do this? And don't you think I've done enough, kind of? And so, but I continued. The reason I decided to do it was interesting. Since you're a horsey place, I'll tell you. I was going to the gym, and I was supposed to have a phone call with this woman. And I said, okay, I'll talk to them, I'll see. You know, I was still very shaken by everything. And as I was talking to Lori Fenton, who's at the Lung Cancer Alliance, there's a lot of sound in the background. And I was just kind of thinking, well, she's somewhere windy, I don't know what it is. And then it got really, really noisy. And she said, I'm so sorry, but I'm in the middle of a fox hunt. I've gotten off my horse. And the fox just ran by. So at that moment, I thought, okay, Chris, I get it. I'm going to do this. Don't worry, I'm in. So it was really that confluence of those synchronicities that told me, excuse me, Deborah, do you need an engraved invitation? This is what you're doing. And so that was how it began. And I said, okay, I get it. It's you, it's the horse, fine, I'll do it. And she was in Virginia, naturally, where Chris had been injured. And so from that point, I started to read this literature. And what struck me was how invisible this disease was. And I thought, all right, now, I was a single mom in med school. I may have missed a little bit occasionally. However, I'm a good physician, I'm a pathologist. You would expect me to have a pretty good idea about disease. And I thought, I didn't know this. I didn't know that there was one cancer that killed more than breast, colon, prostate, melanoma, pancreas altogether. I thought, no, how do I not? That's crazy. How could that be? How do I not know this? How do I not know that the survival rate has not changed in 30 years? And again, I had experienced it through the lens of something different. My sister was a VIP patient. Nobody stigmatized her. It all kind of sailed through. So it was a different experience. I never went on the internet. I was a doctor, my dad's a doctor. I thought, sure, they've got a good treatment, she'll be fine. And it was as this came to dawn upon me, I thought, wow, if I don't know this, I pretty much can guess that the level of awareness about this disease is non-existent, because it's like a parallel reality where this terrible thing is happening and somehow it's not filtering through into our general level of awareness. And I really committed at that point my first commitment was, I'm going to start to tell this story because people love Dana, and I know that all of you, I can feel it, have been touched by Dana or have been touched by Chris and have your own story and your own feeling of connection to them. And it was with that love and intention and taking the energy that they had put into the world that I began to move forward and to start to talk to people and congressional members and to start to raise awareness around lung cancer. And as that began, this was in 2006, so it's a little bit over 5 years ago. It was a very challenging thing because there was a lot of politics wrapped up in lung cancer, and I also noticed that there was a lot of entanglement with smoking and stigma. And I thought, no, this I am going to go after. Because this is not okay. This is when someone has cancer of any kind, one doesn't go up to them and say, well, what were your, what addictions plagued you during your life? What happened to you? Why are you? And yet with lung cancer, the two things became so linked together because when the war on cancer began with Nixon, remember our old friend Nixon in the 70s, this looked like a really great way to go after this cancer. Like, okay, stop people smoking. We're going to drop these lung cancer rates. We've got it. I mean, it seems like a very intuitive, common sense way to go. And yet, in those 30 years, the mortality rates for lung cancer have not changed a bit. So this has not been a strategy that works. And yet, the two things became so linked. And again, I gave this caveat before. Smoking cessation is important for a million reasons. Heart disease, cancer, quality of life, your taste buds, all kinds of things. I mean, smoking, there is almost nothing else you can do that would be a better benefit for your health than smoking cessation. But the cruel injustice of lung cancer is that many, 20% of all of the newly diagnosed people with lung cancer have quit long ago. Actually, 60% of all the newly diagnosed lung cancer patients are never smokers or non-smokers. And so this is this whole kind of messy thing with smoking. And so part of what I did is when I went into this, people said, oh, we want you to talk about non-smoking women who get lung cancer. And I said, no, I'm going to talk about smokers, non-smokers, meth addicts who get lung cancer. I don't care. This is a disease, and it needs its own voice. And so as this has gone on, initially it felt like, how are we going to do this? How is this ever going to change? What are we going to do other than raise awareness and work against the stigma and bring more compassion to this disease and bring the level of awareness? And through this time, you could start to feel, well, screening is in there somewhere. Screening has got to come forward. And I brought with me, I did know, even though we don't have wireless, I do have my iPhone. And I have a note. I'm very active in my community in Boston in lung cancer with just the most amazing women, some and men, some who have lost spouses or family members, and some who have lung cancer themselves. And the other night, this lovely woman named Julia Gaynor read something that her mother had written. Her mother had died of lung cancer and only was alive for 5 months. She was a single mom. She had raised Julia, and they were very, very close, and the mom did yoga and sounded like the most adorable woman on the face of the earth. And so Julia's mother read an article in the Boston Globe at the time about the dangers of screening. And she wrote this letter, and then after this I'll give you the good news about this letter and how things have changed since her mother wrote the letter and since some things have happened in policy and science. So she says, Scott, I read with horror your article on cancer scares that poor Jane Lee did get a scare because she had a tumor that might have been cancer that had to be removed. But she also got something many people with cancer would trade everything they have for, proof that she does not have cancer. She is certified cancer-free, while most women, as your article states, with ovarian cancer only learn about the condition when it's too late because it's so undetectable. And then she talks about how difficult it is to detect lung cancer and addresses further this person's article about the statistical significance of false positives. And she says, possibly a lot of your research was made available from a medical community which prefers the statistical approach. They, like the insurance company, deal in probabilities, not individual lives. Mrs. Garber, as you stated, is a risk and prevention specialist who deals with statistics, not patients. Thank God for the fear of medical malpractice against doctors you mention in your article, who forget their primary calling is to save lives, not to sort the good data from the bad. In case you're wondering, I'm one of those women, 58 years old, otherwise extremely youthful and healthy, who just found out I have advanced stage inoperable lung cancer. She says, to poor Jane, she is so lucky, and yet all we can see is that she's very concerned. Scott, if you want to do a true service to the globe readers, you'll get educated on the subject of lung cancer and screening. They're expecting an explosion in the number of lung cancer diagnoses. And by the way, you'll hear some of the same arguments against testing, against lung x-rays and CT scans, but what the heck? It's only a chance to prove you don't have the disease. I suffer my yearly mammogram with nary a positive result. I have annual pap smears with only an occasional second look, but do so willingly in order to try and catch the deadly cancer early while it's still treatable. Those cancer scares are really cancer-free certifications that any cancer patient would trade anything for. Regards, Christine Matson. Thank you, Christine. So when Christine Matson wrote that article, she was responding as a newly diagnosed patient reading with a kind of an outrage an article about the dangers of screening. And what's happened with us in the last year has been really a miracle in lung cancer. And that is that we have finally, and your hospital is participating in this in such an unimaginably beautiful way by setting up a screening program. A year ago, our own government in the National Cancer Institute finally ended a study which had compared screening by chest x-rays and spiral CT scans, which are very, very low dose radiation, and they're not the big scary ones that you sit in for a long time. You go in, you hear, and then you're done. And those can detect tumors up to the size, from the size of a grain of rice. And when they finished this study, they ended it early because the results were so dramatic. And what they found was a decrease in death, in mortality, which is like the ultimate endpoint, in the patients who'd gotten a CT scan for screening lung cancer. And this was, you spoke of a tipping point, this was the ultimate fantastic moment in this disease, because going forward, if this cancer is caught early, it is an operable tumor, it is a tumor you can survive, it is a completely different situation than if you present with a tumor that's all over your body. And lung cancer has not heretofore had a way of being detected. Chest x-rays can look like pneumonia, they can look like all kinds of things, and you'll hear over and over stories of people who got sent home because they didn't think the person had lung cancer. They'll say, or someone hears, I have a lesion, and they think, well, what's a lesion? That doesn't sound good, but can't be that bad. At this point, going forward, the fact that we have spiral CT scans and the ability to detect these early lesions is the moment in lung cancer we have literally been waiting for forever. Diseases that have screening, the mortality rates have changed. In breast cancer, we have mortality rates in the low 90%. Prostate cancer in the same, and these were tumors that started out, or cancers that had the same bad mortality rate. For most lung cancer patients who are diagnosed, only 15% of them will be alive in 5 years. And even more kind of jaw-dropping is that 60% of that group actually who have stage 4 lung cancer, like my sister had, only 5% of those people will be alive in 5 years. So these are absolutely appalling survival rates for this cancer. And with the advent of CT scanning and early detection, we are changing the face of this disease to become something that is potentially, whether it's curable or not, I cannot guarantee. I work in cancer research. I don't use the word cure, I tend to use the word chronicity, or tend to use the word livable, survivable. And this is a major, major moment. And when I was coming here and trying to find out more about your hospital, and I heard from Phyllis that you had a screening program, I literally jumped out of my seat and I said, I am so excited to come to your hospital, because this is an amazing, amazing thing that you are. You're truly fortunate. Any of you who support this hospital financially or are able to do so in any way, this is major. This is not happening in community hospitals in general at all. This has only recently been put into the guidelines from bigger groups like the National Comprehensive Cancer Network, and this is going to change. Insurance is going to begin to cover this. In having dinner with you, there will be support for people who are not able to pay, and this is something that will ultimately, I think, become more of a routine screening for patients. And I also do add in, you can look at your coronary arteries, which is a big plus. So that is something that brought enormous joy to me. At the same time as when it happened, I really had a bittersweet feeling, because I felt, there's been a lot of, it's easy to talk to the public, and it's easy to write articles about things that try to scare people, or that make sensationalize things. And screening for lung cancer has really been badly done by in that way. And when they finally stopped this trial from the NCI, and it just felt like there was a moment where sanity seemed to come into the world. And that part felt so, so joyous. And I was I work in big pharma. I work for AstraZeneca. As she said, I'm a pathologist, and I work on, I work making cancer drugs. And for us, success is prolonging life. That's a good drug, right? If you can get another couple months or a half a year. And we don't have any drugs that give you, a change in mortality. Drugs don't do that. Most drugs don't. Our endpoints are, well, you can live this many more months. And when you look at something as simple as low-dose screening that you can do, and it can be the difference between your precious life and the end of your precious life. it's a pretty damn big change. So I did run around AstraZeneca and use a lot of expletives and say 20% reduction in mortality. You know, you can't get that with anything. So this is a huge moment, and I feel very, very joyful in this. And I often say that, you know, my interests are very wide and varied, and some of them are sort of superficial. And you know, in the earlier years of doing this, it felt very hopeless. And I would say, well, I'm hoping some things will change, because I'd almost rather be talking to people about like shoes or, you know, like other things or movies. And yet I feel like with this change that we're coming upon now, we're going to see a huge shift, and many more people. We will not have 400 people in America dying a day, which is, you know, the equivalent of a jumbo jet falling out of the sky every day. We will not have this global problem. I mean, this is the biggest cancer killer globally. And as we become a more global world, you know, it's a kind of an odd statement, but, you know, we can see how global things are. We're so interconnected globally. And I know I heavily rely on this when I am, you know, talking in Congress. What do we think is going to happen when, you know, when you reach populations in the developing world where this still remains the largest cancer killers, and those economies are brought to a halt? Because this is going to, you know, that age group is coming into the bigger cancer years. So this is something that needs radical steps. It needs, we have a National Cancer Mortality Reduction Act. I have information in the back for you. There's still no actual governmental policy with how to deal for lung cancer. So we're kind of a weird cancer. You go in and you're, you know, everyone else is organized and they've got mammography and pap smears and PSAs and lung cancer. You come in and you see people and you say, well, we just want to have screening. And they look at you and think, where have you been for 30 years? And you say, you know, it was all, it all really, none of the money went into lung cancer. It went into smoking cessation pretty much. So that has been that's been one of the most major positive things. And in doing this, I really have tried to not only convey information, but also that, again, circling back to what I was saying earlier about compassion, and that we all carry within us the ability to change our own way of looking at things, and to increase our own compassion towards others. And I know when I was a medical resident and I had little kids at home and I had to, you know, I went into work at the VA hospital, that I had resentment. I had resentment about taking care of people, and I had a lot of judgment. And I felt like, well, why, you know, I was a bratty, whatever, 30-something-year-old girl. And I thought, well, you know, I'm taking care of all these people who didn't take care of themselves. And I really had these judgmental thoughts. And I feel like we all have those judgmental thoughts. And around this area, this gives us this huge opportunity to let go of those judgmental thoughts that we may have, and to help, you know, I need your help. I mean, I can be me, and I can speak to you, and I can pray and hope that you're moved enough by my story and by my words and by Dana and Chris's story and their lives to help really with other people with this. When you hear that someone has lung cancer, not to ask, you know, what were their dietary preferences, or were they a smoker, or any of that, because maybe you can let that go for now and really find out how are they doing, and do they have support? Have they been able to find a group of people supportive to them? Do they, you know, are they getting the right kind of treatment? You know, are the other family members supported? And really, as other people, as you talk, or if you think about, sometimes people, maybe their grandmother died of lung cancer and they say, oh yeah, she deserved it, you know, she did this. And we say these things without even thinking about them. You know, and we're holding people in our judgment, and we're holding something against them that doesn't feel good to us, and certainly they don't deserve. So that's really another, along with the CT scanning, which is major news, really coming from more of a heart level and more of a level of where I feel so connected to my sister and to Chris. I feel so moved to spread that message. And that's something that all of you can help really, you know, starting this very second, in making a commitment to open your hearts to people who are suffering from this disease, to increasing the awareness, and to starting those conversations with people about that kind of judgment, or about just those false beliefs that we carry around with us. And I've written something at the end. You know, I have a lot of crazy experiences, and then I end up writing other stuff on the back, but I'm going to read you what I wrote in the first place. And then, are we going to get video? Dude, okay. Yeah, okay. Well, so I'm going to read you this first, and then you're going to see a little video. And then, depending on how Phyllis wants to do this, we can have a Q&A after that, and I'll stay, and I'm really happy to meet all of you. So I do ask Dana and Chris for a lot of help before I come out to speak to groups. They were very focused on New Jersey for tonight, so you got to hear a lot about that. But I also do feel a really strong spiritual component that comes through me from them. And this is by a woman named Esther Hicks. And she says, "You must find a way to allow yourself to keep up with what life is causing you to become." So in other words, find a way to allow yourself really to keep opening up to with what life is causing you to become, if you're to live the joyous life you came here to live. And really what remains for it most palpably for me of my sister is joy. And I say that entirely honestly, that really what I carry from her is joy. And this is really an ever-expanding joy that I feel with her. And I invite all of you to feel it all around you, moving through you, and to act upon it, and to live your lives with that joy and with that love and compassion for others. I thank you all so enormously. I give you big love.